Hi everybody, this is a video about the difference between intravenous versus oral chelating agents. Someone asked a question about this on one of my other videos, just asking kind of what the difference is or what the benefits are of one versus the other. So thank you for the question. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your personal healthcare provider to get that advice. So there's quite a there's differences and there's similarities between oral versus IV chelators. The main oral chelator that folks would typically be prescribed is something called DMSA, and the main IV chelators that folks are usually prescribed are EDTA and DMPS. DMPS can be accessed in an oral form as well, and some people do take EDTA orally, although to my understanding it has a very, very poor gastrointestinal absorption, so it doesn't really bind up heavy metals anywhere except in the inside of the intestinal tract, which doesn't really do a whole lot of good when you want it to get into your other tissues. So generally, those are the options. There are EDTA suppositories that are out there, and there is some limited evidence, to my understanding, that they can get absorbed systemically. But in clinical practice, I haven't really seen them help a whole heck of a lot, and most people don't want to use EDTA suppositories, so it's not something that a lot of folks they prefer to do the IVs as a rule, or the oral chelation. So the differences between the oral chelators and IV chelators are largely around the bioavailability of them. Our bodies are only able to absorb so much of the oral DMSA when it's taken, and so the levels that actually build up in the bloodstream are we just can't achieve the same level of chelator in the bloodstream as we can intravenously, where of course intravenously 100% of the chelator is going into the bloodstream because we're putting it straight in there. But in terms of binding affinity, DMSA as an oral chelator, it's very good. It's really good at binding lead and mercury, which in my experience are the top heavy metals that we're typically dealing with, and it has an affinity for other metals too. With EDTA, it's the best at binding lead and cadmium and aluminum. DMPS is the best at binding mercury and arsenic, and then between the two of them, they combined up some of the other metals as well. So in terms of actually the way I describe it to my patients, whether we use oral DMSA or we use intravenous chelators, we're likely going to get to the same endpoint in terms of getting the metals out of the system. It's just really a question of how quickly is it going to happen. In my clinical experience, I found that oral chelators tend to be about 2 to 3 times slower than intravenous chelators, and in some cases that doesn't really matter. Patient, comes in, we've tackled their chronic health issues, or they didn't really have many health issues in the first place. We're checking the work to make sure that there's nothing kind of bubbling under the surface that might lead to health issues down the road, or we're just putting the final touches on their case, and we wind up testing for heavy metals, and we see, oh, you've got this significant amount of lead, for example. Well, whether we get that lead out of their system in a few, in say 4 to 6 months, or we get that lead out of their system in 12 to 18 months, in that case it might not really matter because they're not suffering unduly every day, and whether we get the lead out ASAP or it takes 2 or 3 times longer, it doesn't necessarily matter in the grand scheme of things. And just quite frankly, the bottom line is that oral chelation is quite a bit cheaper than intravenous chelation, and so therefore that might be a more appealing option. Whereas in another case where a patient's really suffering, we feel like the heavy metals are a significant barrier to them feeling better, or they're just really stressed out about them or something like that, then the IV chelation is something that would be definitely, in my experience, definitely a faster option. I've heard some folks talk about the idea that maybe oral chelators aren't able to penetrate into areas of the body where certain metals are stored, like say in the central nervous system in the case of mercury, or in the bones in the case of lead. I'm not 100% sure that is the case. I think I haven't seen research evidence to say that is definitely the case. If anybody listening has the research papers showing that is the case, please mention that in the comments if you don't mind, because I'd be curious to look at them. But clinically, I haven't really seen a big difference between oral versus IV chelation in terms of net results. Save the time factor to get there. The other factor to consider is that, ironically, oral DMSA, in my experience, tends to be much more likely to cause side effects than intravenous chelation. I find chelation in general is well tolerated, but if I would say for every maybe one patient that flares or feels worse from intravenous chelation, there might be like 5 or 6 that flare from oral chelation, but the absolute numbers are really quite small in that regard. So I hope that answered the question. If the asker has any further questions on this, please feel free to post in the comment section below. If anybody else has any questions about this or any other topic, just post in the comment section below, and I'll do my best to answer as soon as I can.